There are 5 medications that millions of people over 70 take every single day, and 3 of them require no prescription at all. What most people do not realize is that these drugs may be quietly stealing your independence without you ever knowing it. Today, we are going to talk about 5 specific medications that many geriatric specialists now warn older adults to either avoid entirely or seriously reevaluate. Most people assume that if a doctor prescribed something years ago, it must still be safe today. And if a drug is sitting right there on the pharmacy shelf available without a prescription, then surely it cannot be harmful. These are 2 of the most dangerous assumptions you can make about your health after 70. Here is why. Once you cross that threshold, your body handles medication in a fundamentally different way. Your kidneys filter drugs out of your system more slowly. Your liver breaks down compounds at a fraction of the speed it managed 2 decades ago. And your brain becomes far more sensitive to sedatives and certain chemical blocking compounds. A dose that worked perfectly fine at 55 can now lead to dangerous falls, memory problems, kidney damage, and cognitive decline that gets mistaken for normal aging. Every single medication on today's list appears on the American Geriatric Society's Beers criteria, the officially maintained evidence-based list of drugs considered potentially inappropriate for older adults. This is not alternative medicine. This is mainstream geriatrics, and it is information you deserve to have. Along the way, I will share safer alternatives for each one. And at the very end, I will give you a 5-step checklist you can bring to your next doctor's appointment to protect yourself. So please stay until the end for that. Let us start with a medication that is probably sitting in your medicine cabinet right now. Ibuprofen and naproxen, the active ingredients in brands like Advil, Motrin, and Aleve. These non-steroidal anti-inflammatory drugs are the go-to pain relief in almost every household. When your knee flares up or your back starts aching, reaching for that bottle feels automatic. For younger adults using them occasionally, the risks are generally manageable. But for anyone over 70 who relies on them regularly, the picture changes dramatically. Your kidneys are responsible for clearing these drugs from your bloodstream. After 70, kidney function has declined significantly, potentially dropping to half of what it was in your younger years. When ibuprofen or naproxen enters a body with already compromised kidneys, the drug lingers far longer and hits much harder. It progressively damages the very tissue responsible for filtering it out. And here is the troubling part. This kidney damage develops silently with no symptoms at all until it has already become serious. But your kidneys are only part of the problem. Your stomach lining grows more fragile with age, and these drugs directly weaken its protective barrier. According to the National Institutes of Health, older adults who use non-steroidal anti-inflammatory drugs regularly face 3 to 5 times the risk of a serious gastrointestinal bleed compared to younger users. And when that bleeding happens in someone over 70, the consequences are far more severe. There is a third risk that completes what many experts call a dangerous trifecta. For anyone managing heart disease or high blood pressure, these drugs raise blood pressure further, cause fluid retention, and elevate the risk of heart failure. The 2023 update to the Beers criteria specifically reinforced the need for extreme caution with this entire drug class in older adults. So, what can you do instead? Ask your doctor about acetaminophen as a first-line alternative for pain. It is significantly gentler on your kidneys and digestive tract. For adults over 65, the recommended maximum is 3,000 milligrams per day. Joint pain can absolutely be managed without putting your kidneys and heart at risk. You deserve a safer option that lets you keep living on your own terms. But if non-steroidal anti-inflammatory drugs are risky because people take them too often, the next medication is even more alarming because millions of people take it every single night, completely convinced it is harmless. and it costs about $6 at any drugstore. I am talking about diphenhydramine. You may not recognize that name, but you certainly know the brands. Benadryl for allergies. And it is the active sleep ingredient hiding inside Zizquil Unisom and Tylenol PM. Millions of seniors take one or two of these tablets every night to help them sleep, assuming that if it does not require a prescription, it must be perfectly safe. After 70, it is not. Diphenhydramine is one of the most potent anticholinergic drugs you can buy without a prescription. Now, anticholinergic is a word worth understanding. It means this drug blocks acetylcholine, which is the primary chemical messenger your brain relies on for memory and learning. Interfere with that chemical night after night for months or years, and the consequences become deeply serious. A landmark study published in JAMA Internal Medicine in 2015 followed 3,434 adults, aged 65 and older, for more than 7 years. Researchers discovered a clear dose-response relationship. The more cumulative anticholinergic exposure a person had, the greater their dementia risk climbed. Those in the highest use category faced a 54% increased risk of developing dementia compared to people who never used these drugs. The most commonly implicated anticholinergics in that research were first-generation antihistamines exactly like diphenhydramine. A 2019 study in the same journal examining nearly 60,000 dementia patients reinforced those findings. The evidence has only continued to strengthen since then. Let me share a story that puts this into perspective. A woman in her early 70s had been taking 2 over-the-counter sleep tablets containing diphenhydramine every night for close to 5 years. Her own doctor had actually suggested it. Over that time, her family watched her change. She repeated the same questions within minutes. She became confused in places she had known for decades. She would lose words mid-sentence and stare blankly, searching for what she meant to say. Her family assumed it was simply aging. Then a new geriatrician reviewed her complete medication list and flagged the diphenhydramine immediately. Over the following 7 months, after she stopped taking it under careful medical supervision, her cognitive test scores stabilized and partially improved. Her daughter described it as getting a piece of her mother back. Not every case ends this way, but the first step is always knowing exactly what you are putting into your body every night. Your sharp memory is the foundation of your independence. Protecting it starts with understanding what is in your medicine cabinet right now. I am curious. Are you or someone you care about currently taking any of the medications I have mentioned so far? Type 1 if yes, 2. If you are not sure, 3 if no. Let me know in the comments below. Every response helps me understand our community better. The first 2 medications on our list are ones you can pick up at any pharmacy without a prescription. But this next one comes directly from your doctor, and it is prescribed to millions of people every year for anxiety and sleeplessness. Benzodiazepines. You probably recognize the brand names more than the drug class itself. Xanax Valium, Ativan Klonopin. These are prescribed primarily for anxiety and insomnia, and in the short term, they genuinely work. That short-term effectiveness is precisely why they are so widely used, and precisely why they become so consistently problematic for older adults who stay on them. After 70, your liver metabolizes these drugs much more slowly, which means they accumulate in your system. A dose intended to calm you at 10 in the evening may still be impairing your balance and coordination when you get up at 3 in the morning for a glass of water. Multiple systematic reviews have confirmed that benzodiazepine use is associated with a substantially increased risk of injurious falls. In older adults, falls serious enough to require hospitalization. And according to the Centers for Disease Control and Prevention, falls are the leading cause of injury-related death in adults over 65 in the United States. This is not a minor side effect we are discussing. Beyond the fall risk, benzodiazepines consistently impair memory attention and what researchers call executive function in older adults, even when people feel they have fully adapted to the medication. The American Geriatric Society explicitly places the entire benzodiazepine class on its Beers criteria list as drugs to avoid in older people. Now here is an absolutely critical safety warning. If you are currently prescribed any benzodiazepine, do not stop taking it suddenly. Abrupt discontinuation can trigger life-threatening seizures. This must be a conversation with your doctor about a supervised gradual taper. Never attempt it on your own. A single fall at 3 in the morning can change everything, shifting you from living independently to depending on others for the most basic tasks. Knowing this risk gives you the power to have that conversation with your doctor before it happens. Anxiety and sleeplessness drive many people toward benzodiazepines. But there is another sleep medication prescribed roughly 10 million times a year in the United States alone. And what the Food and Drug Administration discovered about it should make you pause. Zolpidem, sold under the brand name Ambien, is one of the most commonly prescribed sleep aids in this country. The FDA issued a specific safety communication noting that elderly patients can have significantly higher blood concentrations of zolpidem the morning after taking it, compared to younger adults taking the identical dose. What this means in practical terms is deeply concerning. You wake up feeling normal. You do not feel drugged or impaired, but your coordination and reaction time are compromised in ways you cannot perceive. You are still pharmacologically sedated without knowing it. Research has linked zolpidem use to a significantly elevated risk of hip fracture in older adults, and hip fractures after 70 carry devastating consequences. The 1-year mortality rate following a hip fracture in adults over 70 ranges from roughly 20 to 30%. That means for every 4 or 5 older adults who break a hip, one may not survive to the following year, often due to complications like blood clots or pneumonia during recovery. There is another layer to this problem. Zolpidem alters your natural sleep architecture. It helps you fall asleep faster, yes, but the quality of sleep it produces is not truly restorative. You wake up feeling unrested, which drives you to keep taking it, then to increase the dose, then to become dependent. It creates a cycle that never actually solves the underlying problem. It just reshapes it. And here is something that may concern you even more. A recent preliminary study from the University of Rochester found that zolpidem may actually suppress the brain's natural cleaning system known as the glymphatic system. During healthy sleep, this system flushes waste products from your brain, including beta-amyloid proteins that are associated with Alzheimer's disease. In simple terms, you are sleeping, but your brain is not being cleaned. Now, this research is still in its early stages and needs further investigation in humans, but the finding is striking enough that it deserves your attention. So what actually works for sleep? Ask your doctor about cognitive behavioral therapy for insomnia, known as CBTI. Studies consistently show it outperforms every sleep medication for long-term results with 0 drug interactions, 0 dependency, and no morning grogginess. Truly restorative sleep does not come from a pill. It comes from allowing your brain to function the way it was designed to, and that is something well within your control. If you are still watching at this point and finding this information valuable, type yes in the comments below. It lets me know this content matters to you, and every single comment motivates me to keep sharing. 4 medications down, and each one may have surprised you. But this last one might shock you more than any of the others because it is among the most widely prescribed drugs in the entire world, and many people have been taking it for decades without anyone telling them what it quietly does over time. Proton pump inhibitors, omeprazole sold as Prilosec, esomeprazole sold as Nexium, lansoprazole sold as Prevacid. For short-term use, 4 to 8 weeks, these medications are appropriate and effective for treating acid reflux and stomach ulcers. The problem is that most older adults are not taking them for 8 weeks. They have been on them for years, sometimes an entire decade or more, without any reassessment of whether they still need them. Long-term use of proton pump inhibitors after 70 quietly depletes two nutrients that are absolutely critical for your body. The first is vitamin B12. Your stomach acid plays an essential role in releasing and absorbing B12 from the food you eat. Suppress that acid for years, and B12 absorption drops sharply. Research published in JAMA found that taking proton pump inhibitors for more than 2 years was associated with a 65% higher risk of B12 deficiency. In older adults, severe B12 deficiency causes peripheral neuropathy, that persistent tingling and numbness in your hands and feet, as well as cognitive decline that closely mimics dementia. People get diagnosed with early-stage dementia when the real culprit is a vitamin deficiency caused by a medication they no longer need. The second nutrient at risk is magnesium. The FDA issued a specific safety communication warning about dangerously low magnesium levels in people who use proton pump inhibitors long-term. Low magnesium disrupts your heart rhythm and nerve signaling, compounding other cardiac and neurological risks that already increase with age. Consider this situation. A 76-year-old man had been taking omeprazole for 9 years. The original reason a stomach ulcer had healed long before, but the prescription just kept getting renewed year after year. He lived with severe numbness in his feet and a persistent mental fog his family could not explain. When his geriatrician finally ran a thorough blood panel, his B12 came back critically low. The doctor tapered him off the proton pump inhibitor over 8 weeks, started aggressive B12 replacement therapy, and shifted his reflux management to dietary adjustments and a safer alternative medication. 4 months later, the neurological symptoms were clearly improving. 9 years on a prescription that was no longer necessary, caught by a single thorough medication review. Numbness in your hands and feet and persistent mental fog are not just normal parts of getting older. Sometimes they are signals that your body is missing something essential, and the solution may be far simpler than you think. Each of the 5 medications we have discussed carries its own significant risks. But here is something most people never consider. When you take several of these drugs at the same time, the dangers do not simply add up. They can multiply. Most Americans over 70 take 5 or more medications every day. This is what medical professionals call polypharmacy. Imagine this scenario. A proton pump inhibitor depletes your magnesium levels. A benzodiazepine increases your brain sensitivity. Non-steroidal anti-inflammatory drugs are quietly damaging your kidneys. Each specialist who prescribed these drugs was focused on their own area. Your cardiologist manages your heart. Your gastroenterologist handles your stomach. Your primary care physician tries to coordinate, but during a 15-minute appointment, who is looking at the complete picture, often nobody is. That is exactly why a comprehensive medication review matters so much and why the Beers criteria exists in the first place. You deserve a doctor who looks at your entire medication list, not just individual prescriptions. That is how you maintain real control over your health. So here's exactly what you can do after watching this. Think of it as your 5-step medication safety checklist. Step 1. Write down every single medication you currently take. Prescriptions and over-the-counter. Yes, include the Benadryl, the Advil, the Prilosec. Over-the-counter does not mean safe. Step 2. Bring that complete list to your doctor and ask specifically for a geriatric medication review. Request that your medications be evaluated against the American Geriatric Society Beers criteria. Those exact words will be immediately recognized by any physician. Step 3. For pain management, ask your doctor about switching from ibuprofen or naproxen to acetaminophen. It is significantly safer for your kidneys and digestive tract. Remember, no more than 3,000 milligrams total per day for adults over 65. Step 4. For sleep difficulties, ask for a referral to cognitive behavioral therapy for insomnia, known as CBTI. Research consistently shows it outperforms every sleep medication for long-term outcomes with no drug interactions, no dependency, and no morning impairment. Step 5. If you have been taking a proton pump inhibitor for more than 6 months, ask your doctor 2 simple questions. Do I still need this? And when was my B12 level last checked? One absolutely critical reminder before we close. Do not stop any prescription medication without talking to your doctor first. Benzodiazepine withdrawal without medical supervision can cause life-threatening seizures. And for anyone managing heart disease, kidney disease, or multiple prescriptions, any medication change requires careful, coordinated medical oversight. This checklist is your tool. Bring it to your next appointment. You have every right to ask these questions, and you deserve clear answers. As we have explored today, these 5 medications from the over-the-counter pain relievers we reach for, without thinking to the stomach drugs we have taken for years on autopilot, all carry risks that shift significantly after 70. Which one on this list surprised you the most? Drop a comment below and let me know. If this information could help someone you care about, please share this video with them. Hit the like button so that more people can find this important information, and subscribe with notifications turned on so you never miss our weekly health content. I believe that your body has changed, and your medication list deserves to catch up. We have prepared more videos on supplement combinations that can be quietly dangerous for older adults. Check the description below to watch. As always, discuss any changes with your doctor before making them. Thank you for watching, and here is to your health.